We intend to ensure that our health facilities are able to cope with the growing needs of the Jamaican population.
That commitment sets out the core mission of the Ministry of Health in 2014. This is the year in review. As part of the mission to facilitate human capital development in 2014, government completed Phase 1 of construction on the final 2 of 4 promised primary healthcare centers of excellence.
All have been officially opened. Jamaicans are now enjoying the upgraded and improved facilities that they offer.
Phase 2 of the project on all 4 centers of excellence, which includes additional infrastructure improvement and acquisition of equipment, began in the year. Other primary healthcare centers also received significant infrastructure improvements in the past calendar year. Among them, a new Type 2 health center constructed at James Hill in Clarendon at a cost of $41 million. The Rocky Point Health Center in Clarendon, rebuilt and equipped at a cost of $32 million. The Williamsfield Health Center in Westmoreland, upgraded at a cost of $8 million. And the Trinityville Health Center in St. Thomas, refurbished at a cost of $3.5 million. Government also signed a $51 million contract to renovate and equip the Nannyville Health Center in St. Andrew. Secondary healthcare facilities were also improved in 2014.
We spent close to $155 million at the Mandeville Regional Hospital. We have spent close to $134 million at the Cornwall Regional Hospital. We have spent over $90 million at Anoto Bay Hospital.
In November, 5 major projects completed at the Mandeville Regional Hospital were handed over. Government also spent $68 million expanding and upgrading several sections of the Accident and Emergency Department of the Maypen Hospital. $31 million went towards refurbishing the Port Maria Hospital's operating theatre.
This facility is in line with the vision that we have for the development of secondary care infrastructure in the public sector.
The Sentence Bay Regional Hospital received a new female medical ward, while $85.8 million was spent improving the Princess Margaret Hospital. $9.4 million of upgrading was done on the Sir John Golding Hospital, and $54.4 million was spent on development work at the Noel Holmes Hospital.
We have spent $70.2 million at Port Antonio Hospital. We have spent $13.35 million at the Black River Hospital. And we have reached and have completed tender to start spending $51 million at the Linstead Hospital.
The ministry also began work on a $389 million project to build environmentally friendly sewage treatment plants at 6 health facilities. And 10 ambulances were ordered to improve emergency health services. In the last calendar year, the Ministry of Health also introduced modern solutions to Jamaica's healthcare system. Island-wide use of the GOJ Health Card began, giving users of public health facilities a number of benefits, including greater access to services, savings, and reduced waiting time for registration. The pilot phase of an electronic patient administration system for the public health sector also started.
Speedy access to records will definitely translate to improved care and resource optimization.
The health sector benefited from strong public-private partnerships in 2014. Several local and overseas donors gifted millions of dollars in medical supplies. Intra-governmental partnerships also took place, including in March when the Health Ministry gave the Ministry of National Security an ambulance to transport wounded law enforcement officers. After 2 years of preparation, surveillance and vector control measures were heightened in July 2014 at the first confirmed case of chikungunya in Jamaica.
We conduct what we call a blitz operation, meaning that we do 3 consecutive nights of fogging to kill any adult mosquitoes which might be in the area, as well as the other larvicidal work. And we also look for breeding sites and destroy them.
A $500 million national cleanup campaign was commissioned by Prime Minister Portia Simsimila to help address the chikungunya outbreak. Meanwhile, the country implemented an Ebola preparedness plan in the wake of an outbreak in West Africa. Numerous interventions were carried out, including Ebola-specific training for key personnel, public education, and acquisition of equipment to help in monitoring and surveillance. In 2014, the Health Ministry advanced work to attack the 4 main risk factors for non-communicable diseases, NCDs.
Tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol.
The health minister announced that a national alcohol policy would be developed to prevent the abuse of hard liquor. Meanwhile, key amendments to the Public Health Tobacco Control Regulations 2013 were affirmed by Parliament, including lowered fines for breaches. The ministry also finalized its revised food-based dietary guidelines to get more persons to eat appropriate proportions of the various food groups.
In addition to these interventions, we'll also be looking at ways to get the population to reduce their consumption of fats, sugar, and salt, and increase physical activity.
Government also remained focused on improving cancer care. A dedicated anti-cancer laboratory was launched at the University of the West Indies, Mona, and a nearly $5,000 subsidy was provided to offset the cost of an important test for breast cancer patients. The breast cancer receptor studies is done at the pathology lab of the University Hospital of the West Indies. More efficient management of the healthcare system, public-private partnerships, and building systems of excellence. The Ministry of Health in 2014, supporting human capital development.